here in Orlando, Florida with ASH 2015, the Scientific Sections and Exposition. And we are here with the editor-in-chief of ASH Clinical News. And I probably should also say this is Dr. Mikkael Sekeres of the Cleveland Clinic. But for our purposes, thank you very much for being our editor-in-chief. Now, in the case of this meeting, what's exciting you? What are the things here that you think are the most interest?
So, I'm a leukemia doctor, and I specialize in acute myeloid leukemia and myelodysplastic syndrome. So I, of course, tend more towards the myeloid malignancies and what's coming out in those settings. We have in acute myeloid leukemia a plenary session where for the first time we see a survival advantage in patients who are FLT3 positive receiving midostaurin, which is a FLT3 inhibitor, in combination with classic 7+3 chemotherapy. That's wildly exciting. We haven't seen something like that in years in AML, and that may be practice changing. We see some reports of other FLT3 inhibitors, which may actually work better than midostaurin, but are in earlier phase studies. And we see some new agents in the form of an IDH2 inhibitor. We'll have updated results on that in acute myeloid leukemia in patients who have the IDH2 mutation. And we'll be seeing some results with another anti-CD33 monoclonal antibody also in patients who have acute myeloid leukemia. In myelodysplastic syndrome, we have a drug called luspatercept, which works in lower risk myelodysplastic syndrome patients who are anemic. And we're going to see a presentation of those data by Uwe Platzbecker and by Ari Aganidis. And we have a lot of molecular data in MDS. One of the things I'm most excited about, actually, from a fellow of mine, is incorporating molecular data into the International Prognostic Scoring System for MDS, validating it in a separate cohort and looking at it in patients who have serial samples, all of whom have been treated. So for the first time, a prognostic system that incorporates molecular data and can be used in patients who are treated in real time throughout their disease course. And we're seeing a lot of these molecular data come out. Our understanding of the biology of myeloid malignancies in general is becoming so much better. The only depressing part of it is that it's outstripping the therapies we have available to offer these people.
Now, in terms of genetics, I mean, you're right, we're getting to know more, but we're also getting some new agents, at least in the trial stage, that look pretty promising. It's been so tantalizing for so long with the promise of genetic agents. Are we almost there?
We're getting there. The challenge is going to be that, for example, in patients who are IDH2 positive, we can only identify that in about 10% of people.
Yeah.
So with a rare disease, something like acute myeloid leukemia affects 4 per 100,000 people. Now you're talking about 10% of that who can get a drug. It's hard to conduct a randomized study and show an endpoint, but that is what's going to happen. With lesions that are even more rare, I think you're going to see an evolution of clinical trials that are developed to try to show their efficacy.
Well, I think this is an exciting meeting, and thank you very much for joining your editor-in-chief here, Dr. Mikkael Sekeres, and for ASH Clinical News, I'm Rick McGuire.